When I was just recruited to this white chair to start just last January, and it was my intent to do healthcare engineering research because I had done quite a bit of it before, and I think it's an extremely important and promising area to work on. But just as I was recruited, Walmart contacted the university about sponsoring a center on healthcare logistics. So those two things were a happy coincidence that came together in that I was ready to do this and Walmart was ready to help provide the funding. The idea of this center is to try to use the tools that have worked in other industries, adapt them into this context. And so there are many, many areas of research to work on there, but we have agreed in this center to work on the part of it relating to material flow and logistics. Let me back up just slightly into saying that we're also impressed with all the advances in medicine, pharmaceuticals and imaging and things like that, that people don't appreciate how really messed up the healthcare delivery system is, which is where you actually bring all these wonderful things to the patients. There's a huge variation among healthcare sites. I mean, some of them are doing a lot of wonderful things. Others are really not any more advanced than they were in 1960. As far as impact, what I hope is that it's going to really cause some transformation in this piece of healthcare delivery that we're focused on. There is a lot of room for improvement there. We will probably begin looking at the various kinds of so-called tracking and visibility tools, things like barcoding and RFID devices to follow stuff around so you know where it is and you know what it is and you know where it's supposed to be. All those things are possible if you've got some kind of computer readable capability on whatever the material is. And of course Walmart is a world leader in the retail store business of being able to keep track of where all their goods are on a global scale. And so they think they have a lot to offer there, and I think I agree with that. The important part is we have to work together. And we also have to work, and I've had preliminary contracts with the UAMS Med Center, because you've got to have clinical people involved. I mean, if you try to go in there as an engineer and say, you guys don't know anything and we're going to clean up this mess for you, you don't get very far. Because there's a lot of real problems that are the barriers that have stopped these materials from happening. And so we want to have clinical partners that we work with. We want to put students in, say, UAMS, say for summer internships or something like that, so they can get very familiar with how clinical people operate and how they think. And we'd like to get the nurses involved in the pharmaceuticals, nursing and pharmaceutical programs and other things like that, so we get the cooperation of all those people.